Welcome, and thank you for joining us for Human Kinetics webinar, Kettlebells for Injury Prevention and Rehabilitation. My name is Alexis Kuntz. I'm the Associate Director of Social Media and Marketing at Human Kinetics, and I will be the facilitator for today's presentation. The webinar is scheduled for 1 hour. The session is being recorded and will be available for playback. By the end of the day tomorrow, you can expect an email containing the link to the recording. Due to the large number of participants today, you'll be able to hear me and our presenter, but you will not be able to speak directly with us. If you're having problems with audio, you may call in by clicking the Use Telephone option in the Audio tab and dialing in with the number and audio pin provided. You may also send questions anytime through the Questions tab or the chat box in the lower right-hand corner of our screen. At the end of the presentation, we'll allow time for a question and answer session. To submit questions during the webinar, use the question function. We're looking forward to a great presentation today, but first, I'd like to give you a little more information about our presenter. Dr. Michael Hartle is a full-time chiropractic physician. He's also certified as a nutritionist, chiropractic sports physician, and strength and conditioning specialist. He also holds the Master's Instructor certification from Strong First, and he is a co-developer of the Strong First SFL Barbell certification. Dr. Michael Hartle travels around the United States and the world teaching barbell and kettlebell certification courses. He's also currently working towards his PhD in exercise science at Concordia University, Chicago. He's been practicing in Fort Wayne, Indiana for over the last 27 years. So without further ado, I'll hand over the presentation. Welcome, Dr. Michael Hartle.
Thank you, Alexis. Good morning, everyone. Our talk this morning is going to be about kettlebells for injury prevention and rehabilitation. All right, next slide. All right. Okay. I've been a chiropractic physician for 30 years, worked in Wisconsin before I moved down to Fort Wayne. Been nationally ranked competitive powerlifter for 20 years. I competed USA powerlifting. I played semi-pro football after that. At the young age of 38, started playing football for 10 years and enjoyed immensely doing that. I'm also a Master Instructor for Strong First, SFG, and SFL certifications for over 10 years. And I decided in March of 2021 to start accessing a PhD in exercise science. I'm in my third year of doing that. So lots of homework, but enjoying every minute of it. All right. This is the book that I wrote with Human Kinetics regarding Kettlebell Strength Training Anatomy. We have a bunch of exercises in it. We're going to go over some of those today. But you can see us in the cover photo there. We have Joshua Poulin, who works for me here at the clinic. And he is showing he's got shorts on, but he's also got all his muscles accented there too. So doing good. Okay, it's also available at Amazon, Barnes & Noble, and of course, Human Kinetics. All right, it's a new website we're putting together for my company, Advanced Strength and Speed Strategy. So when we get it up there, we'll send an email out, let everyone know about it. And we also have a newsletter you can join as well too. All right, so overview, we're going to talk about key kettlebell exercises and their benefits, enhancing mobility, stability, and strength with kettlebells, and safely implement kettlebells in rehab and injury prevention. So at my clinic, we have a rehabilitation department, and we use kettlebells extensively in that department. All right, safety first. I don't care if you're using kettlebells, bodyweight exercise, barbells, sandbags, medicine balls, whatever you want to do, but also having safety is very important. It's one of the things that I appreciate very strongly about as far as my work with Strong First is that we're very technique oriented, but also strength oriented as well too. So kettlebells, proper handling. So parts of a kettlebell, we have the handle, we have the bell, and the base. So this is what a typical kettlebell looks like. We got the handle at the top, we got the body of the bell, then the foot of the base. The base is important because when you do exercises like Renegade Row, which is inside the book, you need to have a flat base to be able to do that with. Also, setting it down on the ground also helps keep it nice and upright for you. When I was introduced to kettlebells back in 2004, basically it was described to me as a cannonball with a handle attached to it. So this is a version of it. People either just keep the original colors, they can paint them, they can put tape on the handles to designate what size the bell is, but we can do whatever you want with them. Safe handling tips, grip. One of the things that is interesting about kettlebells, in addition to doing barbell stuff as well too, and for that matter, like pull-ups and body weight, is that you develop a strong grip. A grip is very important for not only our life, but also for our longevity. As a matter of fact, there's been some recent studies that talked about as far as grip strength, and that when grip strength got below a certain level, those people usually had to go to assisted living or nursing homes, primarily because they were not able to pick up their laundry box or groceries or anything else, and they lost their grip. But when you also make a fist with your hand, you use what we call the law of irradiation. I believe it's Sherrington's law. And what it basically does is it forces all the muscles up your arm to tense and get ready for as far as what's coming down the road. So stance is important. Just, I don't care if you're utilizing as far as barbell, kettlebell, but your stance, even in bodyweight exercises too, is important because knowing where your feet are and what you're doing with your feet is important to access symmetry and not have asymmetry in your lifting. Movement, we'll talk about movement more down the road here. All right, key kettlebell exercises. All right, we got deadlift, the kettlebell swing, clean and press, get up, squat, snatch, row and pull up, carry mobilities. These are actual chapters inside the book that go over it. So not only is the book a bunch of pictures with anatomical illustrations drawn on it, but we also teach you how to do the exercises in the book. So we teach you how to do a squat, get up. We go through the execution of each movement you need to be doing both on the way up and the way down. We talk about as far as the not only the techniques there, but also advanced techniques, even regressions aspect with that. So the book is basically an all-encompassing book that helps you learn how to use kettlebells and then see what muscles, primary and secondary, that you're utilizing. All right, we're going to talk about the kettlebell deadlift technique and benefits. Proper deadlift form, stance, grip, lifting technique. So this is Danny Williams, who's a physical therapist out of Indianapolis here. He was one of my models for the book. He's doing a double kettlebell inside the legs, getting ready to do a deadlift there. Ideally, the deadlift form with the kettlebells is very similar to the barbell form in the sense that, for example, the front of the handles, if they were extended to your shins, should be touching your shins. The kettlebells are between your ankles. And basically, all you do is stand up. We'll talk about that more down the road here. Your lifting technique, you want to make sure as far as that your knees are below your hips, which are below your shoulders. You want to make sure your lats are strongly engaged, your abs are tense, and you got a bunch of tension in the hamstrings backed by the ischial tuberosity, which is where our butt bones, or if you sit on lots of steel bleachers, you know exactly where those bones are. Rehab benefits, lower back strengthening, hamstring flexibility. So one of the first exercises I teach my rehab patients is the kettlebell deadlift, because it's what we call a grind exercise in strong first, but it's also a good exercise to learn how to develop overall body tension. A lot of people do not know how to tense their bodies when they're lifting something. Now, in this case, in this picture here, the kettlebells are down between his legs. So with doing that there, he's going to stand up. If the kettlebells were on a shelf or even above his head, he had proper form to be able to tense his body to protect not only his spine, but to also generate more force to be able to lift it properly. Let's see. All right, so we're going to demonstrate the kettlebell deadlift here. This is Katie in my gym here, so she's going to demonstrate the deadlift here using good form there. All right, good job. Excellent. All right. So if you notice there with her neck, it's interesting because the neck is actually part of the spine, and we want to make sure the neck stays as neutral, or maybe slight extension is allowable with that. But if you do too much hyperextension with the neck, like looking up at the horizon or looking even above it, you can jam up your neck and even potentially your lower back. And if you notice when she's locking out here, she's using her glutes to lock out, not her lower back. Unfortunately, a lot of people do this wrong, and they use their lower back and they lean back with it. You get 0 bonus points for doing that. So again, make sure you're using your glutes, your hammies, to lock out your kettlebell deadlift, and that goes with the barbell deadlift as well too, or even if you're doing a trap bar deadlift with trap bar as well too. Get up technique and benefits. All right. So here's Joshua using a sandbag. We got this actually for one of my patients, and he gave me permission to use his name, Larry McSpadden, which in this regard, we also do a shoe get up. And he's using a sandbag here basically because he's not able to get his fingers to a flat when he makes a fist, so he puts a sandbag on top. But he's up and looking at the kettlebell. He's in what we call the tall sit position of the get up. But the get up form is a step-by-step breakdown from lying to standing. So I love teaching to get up, and you go from a horizontal position to a vertical, back down to a horizontal position. The rehab benefits focus on joint health, shoulder stability, core engagement. So the get up is one of those amazing exercises that engages all four muscles of your abdominal core. So those four muscles are rectus abdominis, internal, external oblique, and transverse abdominis. And those all four muscles are activated very strongly throughout the get up here. Also for shoulder stability, if you look at his picture here, his right arm, which is his hand on the ground, his shoulder has to become very stable because in just a second, he's going to go through what we call the sweep move, where he brings his knee under his right knee underneath his body there. But the other shoulder, the up shoulder, also has to have stability to be able to hold that weight above his head with his arm locked out. So in this case, you're getting a 2-for-1 benefit for it. I played semi-pro football, and we played Saturday night. So what I did usually, I took Sundays off. Monday mornings, I would start do my stretches. Monday afternoons, I would do some get-ups just to actually more as a preventative maintenance slash as far as a little bit of rehab for my shoulders, because the defensive tackle, my shoulders were taking a beating every weekend with the football. So by doing as far as the get-ups, they actually helped save my shoulders. And the only injury I walked away from playing 10 years of football was I sprained my right ankle, but that was the only injury I had in 10 years of football. So, and starting at age 38, obviously injuries can happen. So kettlebells have certainly built a resilient body in addition to barbells and other things I do as well too. So we're going to demonstrate the kettlebell get up here. Katie's doing this again. She rolls to her back. She's going to push the kettlebell up. She's going to go to her elbow, then to her top of her hand. Pack that bottom shoulder, bring to the knee, come up, windshield wiper the leg backwards, look straight ahead, stand up, and she's going to reverse directions on the way down. Now, one of the things we teach as far as when we teach the certifications, the fact that when we do a get up, I should be able to take a still photograph of any part of the get up, and I should not be able to look at the photograph and tell whether you're going up or down. What that basically means, especially in the down phase, a lot of beginners will tend to go down too fast or in a kind of a sloppy way. So we don't want that to happen because you not only are loading the eccentric, but also the concentric aspect as well too. Benefits of kettlebell training: enhance mobility, improving stability, and building strength. So we're going to discuss those here in just a few minutes. Joint mobility and flexibility. Kettlebell halo. So in this picture, Katie's doing a kettlebell halo. So this is a shoulder mobility move a lot of my students do before we actually start our training. And if you notice there, she's bringing the kettlebell around the back of her head, and then she brings it around to the front. And if you look at the two different shoulders and the two different upper extremities, you can see there's different muscles are being activated as she does each one. Now, meanwhile, your core is tight, your feet are rooted, your kneecaps are pulled up, your glutes are squeezed, your core is very tight with doing everything as to do the halos around. So again, this is more about shoulder, upper thoracic, clavicular, even some cervical as far as neck range of motion as well too. Kettlebell arm bars is a great exercise. So when I went to my first kettlebell certification with Pavel, I was thinking arm bars were something you see in the UFC, and I'm like, I don't want that done to my shoulders. I work hard to keep my shoulders strong, but the arm bar is actually a shoulder mobility forward slash a thoracic mobility as well too. So I do arm bars tremendously before my exercises to actually help as far as my movements go better. Goblet squats, basically a squat with a kettlebell, but you're holding the kettlebell with the handles in front here. Kettlebell, the picture in front of the book is a double kettlebell front squat with Josh. The movements of the hips is generally very similar, but the kettlebell goblet squat, you're just holding in front. It's a great exercise to do. You can do it with a dumbbell if you don't have kettlebells, but why don't you have a kettlebell? Off-center loading challenges mobility. So you look at the kettlebell at the handle, when you're holding, especially when you're doing a press, kettlebell snatch, and kettlebell get up, the handle as far as off-center. So off-center, it basically challenges your mobility, but also as far as your stability as well too. Improving posture and balance. Require control through range of motion. Strengthen stabilizing muscles. Excellent for single arm and single leg exercises. So a lot of times when we teach when I teach someone how to do a kettlebell deadlift, we then usually graduate to the kettlebell swing, but we're both hands are on the kettlebell. Then eventually move to a kettlebell one-arm swing where only one hand is on a kettlebell. And it's interesting with that because you're in a sense doing almost an anti-rotation or an asymmetrical lifting, because as the kettlebell is coming up in front with your arm The other side, in a sense, is not doing anything, but it is, because your left, say I'm doing kettlebell swing with my right hand, my left quadratus lumborum, left gluteus medius, as far as left glutes, everything on that left side is working very hard to maintain a straight spine, that I'm not leaning one way or the other. And you do it on both sides, you're actually accessing the asymmetry on both sides, which then in a sense you become more symmetrical. Most sports, as far as when you're playing hockey, lacrosse, soccer, football, when you're running, you're on the ground, your foot's only one foot's touching the ground at a time. Now, when you're in your football stance, for example, you're obviously both feet are on the ground, but as soon as that ball gets hiked, one leg becomes a swing leg, one leg becomes a driving leg, and then you alternate right, left as you keep running. And so becoming very strong bilaterally with both feet on the ground, and then eventually unilaterally with one foot on the ground, is very important as far as to be able to enhance your overall strength. It basically helps deal with any asymmetrical imbalances. That's important as well too, because when you have imbalances, you're going to actually throw off your system. So for example, when we have track and field athletes come in, so I got a 100-meter dash kid comes in my clinic, he tore his hamstring and needs to get treated. Well, you generally take some x-rays and I find some kind of asymmetry going on in his pelvis and lower back area. And I tell him that's why your one hamstring went, not your other hamstring. And so he's not quite understanding. I said, well, when you ran down the track and you pulled your hamstring, you only grabbed one, right? And he goes, yeah, I didn't grab both of them. Well, that means you have some asymmetry going on because only one side basically broke. And in treating that, so one of the things we do is we actually not only treat the hamstring, but we treat everything else. In this case with rehab, we do a lot of bilateral exercises and then move him to, like, this exercise here is a single leg deadlift here. In this regard here, he's got one leg as far as in the air. If you notice, you draw almost a line from his ear down to his heel. It's almost straight. And then his bottom leg there has a lot of tension at the back of his knee and the back of his hamstring. And meanwhile, his pelvis is staying nice and level. So with doing that, this is a great exercise, not only for developing unilateral strength, but also for developing balance and improving his posture down the road. Functional strength, building core muscle strength, functional strength for sports and daily activities, swings, clean, presses, and more. Oh, go back to that. Okay. So in this case here, there's Katie again. She's doing a double kettlebell outside legs swing. And this is a unique exercise because it does stress your body out a little differently than do it between your knees, which is also a great exercise as well too, in this regard. But again, building core muscle strength, you're almost forced to make sure your core and your abdominal area are very strong, and maintaining that tension to help allow as far as your lower body, your glutes and your hammies and your quads to do the proper job. Using kettlebells in rehab and injury prevention. Okay. Addressing imbalances, improving movement quality, progressing gradually. That's a key thing. We'll get that down the road. All right. And customizing programming. Addressing imbalances, target weaker or tighter size, even out strength and flexibility imbalances, help prevent injury. I think, okay. So here's you showing a single kettlebell row. In this regard, I would not progress someone to this first. I probably would have them do either a double kettlebell row or some other exercises as a regression, then progress to this, because this is not only developing his pulling muscles, as far as his lats, his rear deltoid, rhomboids, serratus muscles, but it also is a tremendous core developer and strengthener in this regard, because obviously his abdominal muscles, his thoracolumbar fascia, his quadratus lumborum are working triple overtime to maintain this posture while he's lifting a weight. This is very similar to the Renegade row, which I spoke about earlier. It's in the book. But in that regard, when you're doing it, you're lifting up one kettlebell off the ground at a time. So you go from 4 points of contact to 3 points of contact, back down to 4 points of contact. So this is a great exercise. And here's Joshua doing it. And I'm going to click on it here. So you can see all the tension that's from his feet, through his knees, through his hips, up to his lats there. He's going to turn and face us so you can see what it looks like. There we go. Good. Excellent. Okay. So row technique, body alignment, arm movement, back engagement, everything is engaged in the back and the body. Your body alignment, knees is important, because if you have a rounded lower back or hyperextended neck, or your one knee is not in the same position as the other knee, you're going to have some serious problems down the road. So being in a proper position is better. So this is more of an advanced exercise. It's not something I start out beginners with, but again, it is a great exercise for doing that. Upper body rehab, strength and mobility for shoulders and back. This is a great exercise for your shoulders and mobility, as far as not only developing the wrist, elbow, shoulder, and even scapular mobility, but also as far as developing the mobility for it as well too. All right, improving movement quality. Dynamic nature improves coordination, enhances movement mechanics, increases durability and resilience. Okay. So in this regard here, dynamic nature improves coordination. So even though this get up here, this picture here is a grind exercise, meaning it's not something to be done in a fast, almost hypersonic way like a kettlebell swing, it is still a dynamic movement because you're going through each part. And what I recommend people when they do the get up is they go to each part of the get up and you just do kind of a quick reassessment. Where am I at? Am I in the proper position? Am I not in a proper position? You just do that yourself. Enhances movement mechanics. Obviously, like I said before, I played football Saturday nights. Mondays, I would do these get-ups as far as the help, and I do get-ups later on in the week a little bit heavier. But I did it lighter on Mondays for just enhancing my mobility. For as far as I did it heavier, I did mobility, but also enhancing my strength aspect there too. It increases durability and resilience. Okay, so when you do kettlebells, almost any kind of lifting, I don't care if it's sandbag, barbell, body weight, kettlebell, you're generally developing resilience, especially as you continue with it. Being consistent with your training is huge. And the more consistent you are with it, the better you'll be overall as far as healthy. And then when you get an injury, it's harder to hurt or injure a healthier body. But when you do injure a healthy body, you recover much faster from that as well, too. So when you're doing this, you increase your durability. So when you have to rake your yard for 8 hours on a Saturday, and let's say you're doing kettlebells on a frequent basis, you're still probably going to get sore because you're not used to all that rotation of pulling the rake left and right. But again, you're not going to be as sore because your muscles are used to doing this ahead of time. Progressing gradually. Start with lower weights. Very important. Again, I would recommend you learn technique. One thing about kettlebells, I've seen them as low weight as 4 pounds and as heavy as 92 kilos is the heaviest weight, like 206 or something like that. But again, I would start with lighter weights. Learn your form properly. If you don't know how to do kettlebells, either join a local gym that has kettlebells, ask them, make sure that the trainers can teach you how to do kettlebells. Or even if you go to thestrongfirst.com, they can find instructors. Maybe you can pay for an online instructor or go to their gym and have them do that. But it would definitely, I would strongly suggest that you hire someone to train your technique. And it's very important because, if you want your car work done, you bring it to a mechanic. If you want plumbing work done, you call a plumber, unless you know how to do it yourself. But then most people don't, so you call a plumber. So you call someone to help you with that. Your body is all you have in life that you have full control over. So I would recommend strongly get an instructor that knows what they're doing. And again, this goes beyond even kettlebells. I don't care if you're using barbells, body weight exercises, or even sandbags or medicine balls. If you don't know how to use it properly, find someone. And maybe it only takes a couple sessions. So maybe you're out a couple sessions and paying for them. But again, you're much further down the road when you do that. But it's always start with lighter weights. Less complex movements. So kettlebell deadlift is one of the most basic movements you can learn. And again, you can progress from it. So that standing one arm row is a more advanced exercise. We talk about, as far as in the book, there's Katie doing a SOTS press, SOTS press, and where she's in the bottom of basically a deep squat, and she's pressing the kettlebells above her head. That takes tremendous mobility. And as far as takes a lot of advanced knowledge to be able to do that. So those are more advanced. If you notice, if you have the book, you look at each exercise, at the top there is a ranking of it. And I have 3 kettlebells. And basically something to be ranked on 1 kettle, which means it's a beginner exercise. If it's something that's got 2 kettlebells colored in, that means it's more advanced. And then the third one, which means it's more advanced, you need to spend more time. So I would not do those ones with 3 kettlebells colored in before you learn how to do with only 1 kettlebell colored in. So I recommend you stick with less complex movements first. A 2-hand, or in this case, your 2 hands are on the kettlebell. That's also a less complex movement. A single kettlebell swing, or even alternating hands, where you alternate your hand every kettlebell swing, is also more advanced. So those are more advanced. But learn how your body adapts to it as far as the 2-hand swing. and learn what happens to your hamstrings, your glutes, your quads, your quadriceps lumborum, your abs, even how your arm muscles are working, your lats. Okay, so learn how all that adapts, and learn so that then you can move more to more advanced exercises down the road. Progress slowly as your body adapts. Okay, one of the things I find is people want to have, you know, the old muscle fitness articles where gain 2 inches in your biceps in 2 weeks or something like that. Progress takes time. So for example, in 20 years of powerlifting, my last year of powerlifting, I can only put 10 pounds on my back squat. I put 10 pounds on my bench and 15 pounds on my deadlift. And that's in a whole year's worth of training. For a lot of people, they're like, no way am I going to do that. That's not enough return on my investment time. But in that regard, that's 20 years of building up to that point. So initially I made bigger gains, but again, down the road, progress slowly as your body adapts, because when you do that, you actually train not only as far as your muscular system, but your neurological system. Your neurological system starts to remember how to do these things in a better and better and more efficient way. So as you do that, you can do more complex movements. Avoid overstressing tissues, okay? So we have some stop signs in Strong First, and I didn't put those in the book, but again, we have some stop signs where basically, you know, like you come to a stop sign, you stop, okay? These are things that you may want to stop your set. So let's say you feel you're doing 10 two-hand swings. Well, all of a sudden you feel like rep 8 or 9 that your form is starting to degenerate a little bit. Set the kettlebell down. You do yourself no good by continuing to do it when you're under fatigue, because your nervous system remembers that when you're under fatigue, my form does this. And we want that when your body knows that form, it wants to be good form, not bad technique. Let's say you're supposed to do 5 double kettlebell front squats. But on rep 4, person you're training with says, you know, tells you to set the bell down because he started to notice some changes in your form. Maybe you were flexing your spine at the bottom. We call it butt winking. Maybe you were shifting your hips to one side versus the other side in that rep 4. So again, set the kettlebell down. Don't overstress your tissues. To do that, okay? All right, single arm kettlebell swing. I'm going to have Joshua demonstrate it here. All right, so he did a good job there. So that is a single arm kettlebell swing. Swing mechanics, hip hinge, arm position, movement flow. So when you look at him do a single arm kettlebell swing from basically his rib cage down, okay, everything looks the same as a two-hand swing. Now, if you notice what he's doing with his free hand there, so in this case, he's doing a kettlebell, single arm kettlebell swing with his left arm. His right arm is in what we call the guard position at the top. That's just what he does with that. Some people bring their arm out to the side, but just make sure that you're moving that right arm when it's not loaded with the arm that is loaded. So I'm going to show that again. Okay, so know how it swings back, and I'm going to freeze it. Oh, that didn't work very well. Sorry about that. So when the kettlebell was swinging between his legs, we call that the hike pass. His right arm was going back, so in a sense, it was doing almost the same motion as the hand with the kettlebell. I always like to teach when you're doing the single swing there, pretend you have headlights in the front of your hips and the headlights in the front of your shoulders. So you got 4 headlights are pointing forward. So they should point forward both at the bottom, at the top, and at the bottom. So what people tend to do a lot of times is that as that right arm goes between his legs, people will rotate their shoulders, which creates some torsion in your spine, which is not necessarily very healthy for your lower back and for your torso. Okay. Benefits: core engagement, cardiovascular health, hip mobility. Cardiovascular health is fantastic. Now we're talking about the single arm kettlebell swing here, but most of these ballistic, we call them, or dynamic movements here, really tremendously help your heart rate, because unfortunately nowadays a lot of people do not get their pulse rate up. They basically get out of bed, walk to the kitchen, make breakfast, go to the shower, walk to their car, go to their job, sit all day, and then they walk from that and repeat and reverse that when they get home and go to bed. They don't really get a chance to get their heart rate up. So I always tell people you need to get your heart rate up, 2-3 times a week in a safe way. And if you have issues, go see your physician, your cardiovascular physician, for permission or for recommendations on what to do with that. But besides that, you've got to get your heart rate up, respiration rate up. You want to get a sweat going. And the reason is that our bodies, one of the main reasons that men who are, say, age 50 have heart attacks when they're shoveling snow. I'm from Minnesota originally, so we love snow. Versus boys who are age 16 shoveling snow and the same thing don't have heart attacks, is because between 16 and 50, they develop a lot of atherosclerosis and their bodies are out of shape. And so when their heart rate gets up when they're shoveling a heavy snow at age 50, their body doesn't know what to do, and their body's in a poor shape, so they end up, basically having a heart attack. Their carotid arteries start to seize up. They maybe even get a emboli in there. So things are not pretty when that happens. So my suggestion is, at age 56, I usually go out 2-3 days a week, go for a hard walk. I use kettlebells. I do some barbell work. So I use a lot of exercise because I don't want my 60s, 70s, and 80s to be deconditioned. I want to be conditioned to go through those times. So this, obviously, cardiovascular health is huge. Hip mobility is fantastic, both in the kettlebell swing, but also in the goblet squat too, which we spoke about earlier. All right, customizing programming. Tailor exercises, weights, and volume. Again, when you're starting with less complex movements, doing 2 to 3 sets of 6, maybe even 8 reps if you want to go that far as the deadlift is good, but make sure that your form and technique is solid through all those 8 reps. And the weights, make sure. So for example, if I was starting to use kettlebells at my young age of 56, what I would do with that is I would probably use a 20 kilo or 24 kilo, which is 44 pounds or 53 pounds. I weigh 260, so it's not a lot of weight compared to my body weight. It's not too bad. If I had a man who weighed 160 or 150, I'd probably start him on the 16 kilo or the 20 kilo for the deadlift. You should be able to handle that. But in volume, you want to keep your volume low in the beginning because you don't want to get yourself so sore that you have a hard time getting off the toilet and 2 days later, okay? Focus on problem areas. So problem areas, as far as, for example, most people don't have as far as glute activation. So a lot of people have what we call it gluteal amnesia, whatever term you want to use it, but basically their hamstrings and their erector spine and their lower back are working triple overtime and their glutes are not working. So one of the best things about the kettlebell deadlift is a starting exercise, the fact that it actually enhances your gluteus maximus, which is the biggest and strongest muscle in the human body. Avoid aggravating injuries. If you have an injury, so for example, we talk a lot in the barbell certification, and if you have shoulder mobility issues, instead of starting with the back squat or front squat, start with as far as the Zercher squat, which you hold the barbell in your elbows. Let's say you have as far as an issue as far as holding a double kettlebell front squat because you either have an elbow issue or a wrist issue. Well, then use a goblet squat. If you're doing a get up, maybe don't do it with weights, do it with a shoe or a sandbag. And then eventually, as you get stronger and start balancing out the weaker and stronger areas, so a lot of times these aggravating injuries start to fall by the wayside. Case study. All right, we're going to talk about Larry here. He gave me permission to use his name. So he started as a patient with me at age 62. He came to me, he already had double knee replacements probably about 5-10 years earlier, but he came to me for chiropractic treatment, but he found me through the strongfirst.com website, and he wanted to also learn how to use kettlebells. Well, he was about 6'2", 6'3". When he was younger, he was down about 6'1", I think, when he came in. And he had a lot of thoracic kyphosis, so almost hyperkyphosis, where he had more rounding in his upper back area. He was an insurance agent for 30 years at that time. So a lot of sitting at computers and everything with that. And so when he came to me, so after a period of time, he had a hunchback. From treatment, we were able to do, we actually made him a 1/2 inch taller. Now, I did not make his vertebrae grow more dense. What I did with that is by actually decreasing the hunchback, we measured him about 6-8 weeks later, he was a 1/2 inch taller. And he was amazed. And I said, well, that's just because we started to straighten you out with that. We also taught him kettlebell exercise to build strength, mobility, and stability. So the reason I bring up Larry here at the young age of 62 is that last Super Bowl, earlier this year, there was a commercial in there about a grandfather who wanted to pick up his granddaughter, and he started lifting kettlebells to be able to do so. And so I thought it was kind of a unique commercial because he actually did that to be able to be more resilient and durable to pick up his granddaughter. So I thought that was interesting. He's 74 now. He's still using kettlebells and mobility exercises. He's doing a great job with that. So thank you to Larry if you're listening for letting me use your name. But here's a gerontological aspect where we're someone who's 62 and now he's 74. He came in, he's got double knee replacement. I want to bring that up too because he could do either a goblet squat or a single or double kettlebell front squat below parallel. So here's a guy who had double knee replacement and he's got great mobility from doing it. So I'm going to tell all those people out there who are either going to get knee replacements or have already had them, make sure you do your rehab after that. And then after you're done with your rehab, keep working. It takes a good 1 to 2 years after a hip or knee joint replacement to become fully healed from it. You're not going to have much pain at that near the end of that. But again, you want to make sure you get range of motion. A friend of mine in Canada has got a hip replacement, and he's actually back doing back squats and deadlifts and everything with that, and he's doing great with that. So keep working on that. He said, Dr. Hartle showed me the way to build my body and rebuild the body, start with the basics of safe movement and proper technique, and you can do the same. Underrated kettlebell exercise, loaded carries. We're going to go through this quickly because we're getting close to being done. Loaded carries, carry technique and posture improvement, carry variations, farmer's walk, overhead, and suitcase. So carries are where basically kettlebells are great because they have a great handle. You put it in your hand, you go for a distance, 40 yards, 20 yards, 3 miles. I'm joking with 3 miles, but you do that. So a lot of people just do carries in their hands. Some people put it up to their chest, like in a kettlebell front squat, but they call it the rack carry. Some people do overhead, and some people suitcase where you're only having one kettlebell walking beside you. It's a great exercise. I know Dan John has talked a lot about it. I use it a lot with my patients as far as for rehab. It's also great finishing at the end of a training program. One comment about overhead and even rack carries a little bit, you need a good amount of thoracic mobility to be able to not only put the kettlebell overhead like in a standing press, but you also need good, even better mobility to walk with it and maintain that position. So make sure this is a highly advanced exercise. I think it's a colored 3 bells in my book. Please do your due diligence getting improved with your mobility before you actually try the overhead, but it's a great exercise if you do. All right. Summary, question and answers. Recap of key points: safe kettlebell usage, exercise benefits, implementing kettlebells in rehab prevention. So we have a lot of patients who have gone through rehab. Now they're in what we call post-rehab or prevention aspect. They still do kettlebells. They do all their other core exercises, but they maintain that because, like I tell people, we don't want you to live in your work posture. So if your work posture is all hunched over a computer all day, you need to spend some time opening up at the end of the day. You got to hit that reset button because otherwise you're going to be living like this and be stuck like that and possibly live a lesser quality of life with that. Open to questions. So, Miss Alexis.
Yes. Okay, so if you do have a question, feel free to go ahead and drop that in the question box. You'll see that in the toolbar it's probably on your screen on the right-hand side. So feel free to go ahead and do that now. While we are waiting for a few questions to come in, I will go ahead and mention that you can purchase the book on our website for 20% off with the code Kettlebell20, and you'll receive information about that via email. Okay, so one of the questions we received is, what is the best exercise for rehabbing your shoulder using a kettlebell?
So what I would do is I would do the kettlebell arm bar as a mobility. We also have the kettlebell pullover exercise in the book too, as far as for mobility. And strength-wise, the get-up. The get-up is one of the best exercises for developing as far as shoulder strength and stability and mobility. One of the beautiful things about doing the kettlebell get-up is the fact that you can actually break it down, meaning that, let's say you just want to do going from horizontal to the elbow and back down. You can do that. And I actually have some of my patients. Matter of fact, when I get someone ready for the level 1 kettlebell cert, I have them do a lot of floor to elbow, elbow back to floor. But we had Larry actually in that example. He hurt his shoulder during the training, and so we did the kettlebell get up from the floor to the tall sit. So that's where his arm is straight on the floor, back down. And then we did from the top part down to the half kneeling aspect. So we worked that part because the sweep part of the kettlebell get up was difficult for him to be able to do because of his shoulder pain. So in treating his shoulder as a clinician and then also giving that, so eventually we got to a point where he didn't have that. So we merged the two back together, and then he was doing full get-ups.
Okay. There was another question that came through. They were asking, and this is in regard to Larry that you were just talking about, what exercises did you do to improve his posture? So they're interested in like the lengthening of the spine. So if you could kind of delve into some of the specifics that you did.
Sure. The kettlebell armbar, again, I'm going to back to that again. So when he did the kettlebell armbar, ideally what you want is the hand that's in the air, which is holding the kettlebell. That arm needs to stay perpendicular to the floor. That's a no-go. I mean, that's where you need to keep it, okay? When you're bringing your pelvis, you're rotating your front of your pelvis. So you have a sharp bone in front of your pelvis called the ASIS, the sharp one on each side. And your goal is to get that ASIS as close to the ground as possible. Well, Larry, when he first did it, his hip was pointed up to the ceiling with his hand that was in the air. He moved it maybe 2 inches, and that was his range of motion. That's all the thoracic mobility he had. And eventually got to the point where he was able to get that hip about 45 degrees from that top arm. So he went from having maybe an inch or two of movement to basically almost 6 to 7 inches of movement. So by doing that, that increased the mobility of his thoracic spine, which then enabled me to give him his chiropractic adjustments in a better way. But also, too, those two things really helped enhance as far as the movement in his thoracic spine, which then got him to decrease that hunch, which then got him a half-inch taller at age 62.
Okay. One of the people listening asked if you can talk about how to hold the kettlebell, as far as how it's positioned against your wrist, if you're going to have issues with your wrist. So basically just placement.
Right. Okay. So we in the kettlebell teaching, we basically say there are no wrists in kettlebells, and here's why. You got 8 small bones here called your carpal bones here, and they're like little tiny rocks inside your wrist there, and they're very strong. But they can also be damaged if you do a lot of extension with it. So in the kettlebell world, we want the wrist straight. We don't want it flexed too much, and we definitely do not want it extended. So for example, let's say I'm doing a kettlebell clean where the kettlebell comes up like this, my wrist is straight. I'm not like this, I'm not like that. When I'm pressing the bell overhead, my wrist is straight. It's not extended or flexed. When I'm doing a get up, the wrist is straight. And that's designed that way to, one, not only protect as far as the wrist, but to actually utilize your grip much stronger. So if I do this to extend my wrist, a lot of people tend to lose some of their grip strength. So we definitely want to make sure there is no wrist when you're using kettlebells.
All right. Another individual, he resides in Turkey, and he had asked the question of whether there's a difference between Russian style and American hard style technique with kettlebell training, and if you can touch on that, if there is a difference.
If you're referring to, so Pavel, who came from the country of Belarus, Minsk, and he brought the kettlebells were over here before that, but he actually really popularized them and taught how to do this stuff. It's called Russian hard style. So in that regard, they're very similar. But if you're talking about as far as the actual competition aspect, so when you do like a kettlebell snatch in hard style, is done differently than a kettlebell snatch as far as in competition, because in competition, you do a certain motion to enhance the mobility or the momentum of the kettlebell. We don't do that in hardstyle. So there is a little difference there. It's about the best I can do without showing on a video or in a book as far as the difference there, but very similar as far as that, because Pavel came from over there, so he called it Russian hardstyle. Then now it's called strong first.
Okay. One individual was asking, they had rotator cuff surgery. So they're curious about the outcomes of after having that and training after having rotator cuff surgery. Just if you could speak anecdotally, perhaps on anything you've seen in that regard.
Sure, no problem. So let's say they're 8 weeks post-surgery. What I would have them do is I'd have them do kettlebell deadlifts. They should be able to hold a kettlebell like this on the handle so they can do a goblet squat. I might even have them just do body weight get-ups with no weight, no shoe, no sandbag at all. And maybe not even do a sweep, but maybe go from the floor to the elbow to as far as a tall sit and back down again. I would probably not do any overhead movements for a period of time just to make sure the range of motion. I'd also have them do the kettlebell armbar and the pullover for mobility, but I would go to the point, I would not push it. So for example, when I do the kettlebell armbar, it's interesting because there's no kettlebell armbar world championships. I'm not going to go to the local bar and brag that I did a 48 kilo armbar that night. I do the kettlebell armbar. I weigh 260 with a 12 kilo or 16 kilo. That's it. I'm doing it for mobility purposes, and that's why I want to do it. When I'm doing pressing, that's when I'm pressing heavy bells or doing get-ups to heavy bells. But again, with doing as far as the kettlebell armbar, even without a kettlebell, would be fantastic for as far as developing the mobility and stability. That's the number one thing they need to do as far as initially after a rotator cuff surgery. But then eventually they can move into doing, kettlebell with a get up with a kettlebell. They can do as far as an armbar with a kettlebell. Maybe not just doing a goblet squat, but doing as far as even a single kettlebell front squat. Even doing kettlebell swings would be good too. So there's some good answers there.
Okay. This individual, they're asking, what exercises would you recommend for treating scoliosis or somebody who's dealing with that?
Good question there. Well, first thing I would do with them is I'd run them through some type of rehabilitation assessment. So Greg Cook-Lee Burton put together called a functional movement screen FMS, which is a great muscle as a screen. We also added other assessment tools to that as well too in our office there. So first up, I need to see what they can and cannot do, where they're weak and where they're strong. Based on that, so what I would do with them, I would most definitely probably give them the arm bar. Sorry for keep repeating the arm bar, but it's a great exercise to be able to do. I would also probably have them start with the kettlebell deadlift, very basic exercises. Once they're improving, now the one thing about scoliosis, especially idiopathic scoliosis, is the fact that if their curve has stabilized. So people who don't know scoliosis, basically it's if I'm looking at you from behind, your spine is supposed to be perfectly straight from your head down to your tailbone. The curves out to the side. And some people naturally have that a little bit in their lower back or lumbars, but again, we're talking more through the thoracic lumbar area. So if it's stabilized, then I would start possibly doing maybe some kettlebell swings, maybe two-hand swings. I'd maybe do some single-hand swings would be great. But I also would be very diligent in making sure that they also get their curve assessed maybe twice a year, just to make sure that the training doesn't make that curve worse. And that's the biggest thing. And I can't necessarily guarantee whether it will or will not, because every scoliosis case that I treat is different. Even though they all have similar as far as etiology, symptoms and everything, it's a lot different in every individual. So I see some people stabilize, never change, get strong as a bull. Other people, they start doing a certain exercise and all of a sudden their curve gets worse. We get rid of that exercise, their curve goes back to where it was before. So you have to do your due diligence with that.
Okay. Along those lines, we had a question still regarding the back. They were asking about hanging from a bar in terms of they've read that they could hang from a bar to let the spine relax. Can you comment on that, and if you think that is suggested or not?
Well, that kind of goes out the parameters of this PowerPoint. But what I would tell my patient, this person was my patient, is I would say, yes, go ahead and do so. Make sure your spine is in a healthier enough state to do that. I even recommend sometimes people getting the inversion tables to stretch out their spine. There's not much research that talks about the benefit of those, but I know I even have one at my house too. So a lot of times if I've been doing lots of standing or lots of sitting, I will just go ahead and stretch out for a minute or two, and it seems to help. You can, if you just want to hang from a pull-up bar, you can do that as well too. But again, make sure your spine is in a healthy. If you have a hot disc, you sprained your sacroiliac joint, this is something I would not do until that calms down.
Okay. All right. I have one last question here. If you do have any more questions, feel free to submit them now. The question is about elbow pain. This person's been dealing with some big elbow pain for a while now, and they want to know, are there certain exercises they should avoid to help reduce that elbow pain, or things that they should be doing to help with that as well?
That's a good question. So elbows are like your knees in the sense that, your elbows usually generate most non-traumatic injuries to the knees are because either hip and pelvis lower back injuries or ankle injuries or both. Same thing with the elbow. So a lot of times you have neck, scapular, thoracic, shoulder issues and or wrist issues with the elbow. So if they're able to straighten their elbow fully, kettlebell deadlift is great for that, either with just two hands on the kettlebell or a suitcase deadlift. And again, this is also described in the book too, with one side with that. Those are great exercises. If they have problems flexing their elbow, if they have problems extending their elbow, doing things like the GABA squat is great, because you're, in a sense, you're flexing the elbow with that, but you're just holding the kettlebell in that position. You're not actively trying to contract as far as even flex the biceps even more with that. So it really kind of depends as far as which one is there. If you have issues flexing the elbow, then even a get up, for example, is not too bad. Now, the only thing with that is if you have flexing the elbow, is going from the floor to the elbow, your elbow's flexed. So maybe in this regard, they start at the top position and they go down to the sweep and come back up. So again, I said earlier, you can break the get up into different parts and use those parts to serve your purposes. And then down the road, go ahead and go back to the full get up, or in this case, we call it the get down, where you start from the top, go down, and finish it back at the top again.
Okay, and then the last question we have, oh, no, one more came through, but let me ask this one first, is if you're new to kettlebell training, and let's say you wanted to invest in some kettlebells, I know earlier you talked in your presentation about starting light, but what would you suggest if you were to kind of make that investment? Where to start with what size of kettlebell you should get?
So let's just break it down to the different sexes. Or so for females, if you're like, let's say average 140 pounds, what I would say you probably want to buy a 12 kilo, 16 kilo, Eventually, you might need a 20 kilo, but not right away. You might even want to get a 10 kilo or 18 pound, the difference in size. So 10 kilos, 22 pounds, 18 pound kettlebell to do some get-ups with that. So those are some good exercises. If you're a man who says 180 pounds, you may want to get a 16, 20 kilo, maybe even a 24 kilo to start with. Those are some good kettlebells. And yes, initially when you buy a kettlebell, it seems like a lot of money, but once you buy it, it will outlast your life. It will, unless you throw it away, which I have no idea why you would do that. But again, you can't imagine throwing it in the garbage can, have the garbage guy take it away. But again, if the kettlebell will stay healthy for the rest of your life. So it's not something you need to reinvest unless you add to your collection. I know people who have, not just single kettlebells, like a single 16, a single 20 kilo, but they actually have doubles. So they can do double kettlebell front squats, double presses, double snatches, all these different things with that.
Okay, thank you. And then I believe this is the last question that's going to come through. We have somebody, he is a Strong First instructor, and he has a client who's a 67-year-old male, and he's torn his hamstring. They just started kettlebell training, and he's wondering, are there any recommendations or exercises that he should avoid? And to note, he has been cleared from his MD.
Okay. So what I would do with that person is I would probably make sure that he's doing some type of either self-myofascial release, whatever, to take care of some of the scar tissue back there. Maybe even see a massage therapist, but that's, again, not what he's asking, but I would recommend doing that. Kettlebell deadlift, either double kettlebells, single kettlebell, or even suitcase deadlift would be great for developing asymmetry, because obviously when you tear a hamstring, it's on one side of your body. I've never seen anyone tear the exact same hamstring in both places, on both sides of their body. So he has some asymmetry. If he's advanced enough at kettlebells, he can do the single leg deadlifts, okay? We showed that picture earlier. So that is fantastic for that. And you can decrease or increase the tension on the hamstring with that exercise by how much you flex the knee or don't flex the knee with that. Goblet squats are great. So those are exercises I would recommend for that. So hopefully that answered your question. If not, you can reach me privately afterwards, and I'll give you my information here in a few minutes, or actually probably when we're done here. And you can ask me privately with that question.
Okay. And this might be, we had another individual who just wrote in a question. It might be better for him or her, I'm sorry, to reply to you individually. They're asking about pain behind their knee, and they've gone to a physical therapist, and nobody's really helped. But I would suggest probably reaching out to Dr. Hartle. He's provided his information here for more personalized questions like that. So thank you for everybody who has joined us today. As I mentioned earlier, feel free to visit our website. You can purchase the book, Kettlebell Strength Training Anatomy, on our website for 20% off with the promo code Kettlebell20. You'll receive an email within a day, probably by tomorrow afternoon. You'll receive an email. It'll have that promo code. It'll also have a recording to this whole webinar if you'd like to go back and watch it at a later date. So thank you again for everybody for your participation today. Thank you, Dr. Hartle, for a great presentation, and we hope you have a great day.
Yes, thank you.